Okay, we set the clocks ahead this weekend, as you know. The good news, of course, is the days get longer. The bad news, we lose that precious hour of sleep. And that loss, combined with now going to bed when it's still light outside, can make bedtime anything but sweet dreams more of a nightmare for many of us. So we're so happy to welcome Dr. Vince Viscomi, a pulmonologist, also the medical director of CHI Memorial's Regional Sleep Center. Good to have you.
Thank you for having me.
So a lot of us, I would be among them, we're super excited now to see the days get longer. You get to have more time outdoors with your kids, but it is so hard to lose that hour of sleep, and it's going to take you a while to make it back up again, right?
And especially tough on a weekend, because on the weekend you've gotten up a little later on Saturday and Sunday, and so when your body's, I just got up later for now I have to go to bed earlier, and it's lighter.
Right.
So you have the double whammy of that Sunday night where you have to try to go to bed earlier, it's lighter, and the last 2 nights you just went to sleep later.
Right.
So you have that really extra problem. And that Monday, there's a blip in motor vehicle accidents, a lot of other things of that, all from sleep deprivation.
So I know it's kind of late in the game, but we still have a few days to ease our way into it. So for parents with kids at home especially, is it a good idea to try to get them to begin to wind that clock down this week in preparation for the weekend?
Well, the key is to make sure they get up maybe earlier on the weekend.
Okay.
I'm not sure you can do much during the school week because they have school and whatnot. It's hard to maybe adjust that. But on the weekends, when they try to sleep later, that is what makes it or magnifies the problem on Sunday night.
Okay.
So on Saturday and Sunday, if they can get those kids up a little earlier, maybe an hour earlier than usual, it would make a transition a little bit simpler.
You also have said that studies have shown as we get older, we naturally need less and less sleep, but not if you're a parent with teenagers. You got to watch them closely.
Well, that's true. You know, between birth and death, usually we transition to needing a little less sleep. And you know, elderly need a little less sleep than a younger person, except for adolescents. In that transformative time, they actually need about 8.5 hours of sleep. Part of why this movement for starting school a little later. The little ones get up earlier, and so maybe they should start school earlier. And the older ones sleep later, which we can't do anymore. But also it's because they have a biologic shift of their time clock. There's a hormone called melatonin that in adolescence is released later, and then on later into the night it's released. So they naturally go to sleep later and get up later.
So we're working against nature.
We are making that difficult for them. Yes, ma'am.
Okay, let's talk about snoring. A lot of married couples out there are going, oh, I can't wait to hear what he says on this one. But the truth is, snoring in and of itself is not necessarily a health concern.
It could be an interpersonal concern. There may be some people with some chest pain from elbows, but what it does signify is your airway's narrowing. And so that it narrows enough so that the tissues vibrate as the air goes past. And so long as the air is moving, you're snoring, we're okay. When that gets narrowed enough that you're not snoring, can actually be worse. I have many patients that when they're snoring, we can see that they're moving air, and then when they get quiet, it's because the airflow stopped. Not that they're better, but they're actually in a more dangerous situation. So what we look for is, does your snoring change in intensity? So is it really loud and then gets a little softer and then a gasp? That's sleep apnea. Loud, unchanged snoring that's just one pitch is usually a little less to be concerned about. Very irritating, but not necessarily as dangerous.
So you've been with the Sleep Center how many years now?
That's painful. 27.
All right, I'm kind of glad that was your answer, because in the course of that time, have you watched people coming into your office in the center to have these sleep studies done and complaining about the lack of sleep escalating, and have electronics played a role in the problem?
Well, that's a good question, and the answer is yes. We're different types of people. When I first started, it was they have something has a computer, whatever has blue light. Blue light hits the back of the retina, and it's alerting. You know, you think a bright sunny day, wide awake. A gray, dreary day, easy to sleep, because it's the blue that does it.
Gotcha.
And so electronics, and with our children, we had a little kind of finesse that a little bit. So you can actually have their phones turned off from 10:30 to 6:30, so that we didn't be tempted, and we're tempted with that.
It's not something to overlook, I guess, is my point. And we don't have time to get into all of it, but a lack of sleep is far more than just being irritable in the morning, because it can lead to some health problems potentially.
Big problems. I mean, they show heart disease is higher. Big deal with diabetes, because diabetics don't sleep well. They actually have a higher risk of sleep apnea, but it affects your hormones, your appetite, and your satiety, called leptin and ghrelin, kind of odd hormones. But if you don't sleep well, you're actually more hungry, and you don't feel full. So you eat more and gain weight.
We are so glad that you came to spend time with us this morning. You can find him at CHI Memorial's Regional Sleep Center, appropriately the phone number 495-REST-7378, memorial.org/sleep. Hopefully you'll take his advice and get up a little bit earlier on Saturday and Sunday and sleep much better in the week to come. Good to have you.
Thank you for having me.
We're back after this.